magnetic fields. So that's just not been studied in the U.S., but it's well known abroad. One of the major actions of magnetic fields, and the way you decide how to use a magnetic field, is less predicated on a diagnosis. In other words, do magnets cure diabetes? No. Do magnets cure hypertension? No. Do magnets cure Crohn's disease? No. It's more important to think of magnetic fields in terms of what they do to a body, what they do to biology. If you think of it in those terms, then it doesn't matter what the diagnosis is. Most conditions have certain of these elements as a constant. Almost all of them will experience some of these elements. The major magnetic field effects include vasodilatation, or opening of blood vessels. That is caused by a reduction in the spasm and the contractility of muscle, any muscle, including the muscles that control the blood vessels. There's an independent action on reducing pain. There's another action in reducing inflammation in the body. And additionally, you get acceleration of wound healing. Even surgical wounds, any other kind of wound, there are many studies that demonstrate that there is an improvement in the healing and the acceleration of the healing process. A major benefit of magnetic fields, and one of the ways that magnetic fields help with healing and decrease pain, is that you easily remove swelling or edema in the area of the tissue injury. We've also seen magnetics significantly reduce bruising. There have been a number of studies that have looked at bruising. We have a study going on with the QRS right now that's looking at post-operative bruising for chemical peels and plastic surgery. A key action of the pulse magnetic field, which is the same as the static magnetic field, is acupuncture. The effect on the acupuncture system. In 1974, Dr. Robert Becker and his group discovered that acupuncture meridians were actually DC current meridians. They may be more than that in terms of the biofields of the body, but one of the characteristics of the meridian system is that it probably has a DC field function or characteristic. So if you understand those basic actions, and one of the actions I mentioned before already also is the anticoagulant action, or decreased stickiness of platelets and decreased thrombosis in blood vessels. Well, why do these magnetic fields, why do pulse magnetic fields do this have these benefits in the body? It's not completely understood why that happens. One of the major actions of the magnetic field is found to be through the sodium-potassium exchange in and out of the cell, and also the calcium exchange, or the calcium channel, in and out of the cell. It's by stimulating the inflows and outflows of calcium, sodium, and potassium, cells begin to function better. The energy packets inside the cell, called the mitochondria, improve their function. As the magnetic field sweeps across cells back and forth, it stimulates electrically, in a sense, through the electrolytes in the body. It stimulates the metabolism of the cell and helps the cell, because it begins to open up the cell membrane and changes the polarization, the basic potential of the cell membrane. It helps the membrane and the cell to actually get rid of water and carbon dioxide or other waste products, and probably even toxins. That's another major, very important action of magnetic fields, and that's how they probably end up working in the body. There are essentially two kinds of effects of magnetic fields. One is the basic magnetic action, and we mentioned the static fields. They cause a basic magnetic action, whereas a field like the QRS tends to cause more of an electrical action in the body. It's electrically stimulating. It stimulates the body's own bioelectric processes. Using a very gentle field. Again, because this is not a natural biologic field except for the movement of people in the Earth's field, the body will recognize the signals that are produced by these artificial fields in a way that would not be recognized using static fields. So you can get a much faster action, a much stronger action in the body with pulse fields than you typically can get with static fields. Not always, but most of the time that's true. The QRS was designed with the principle in mind of causing tissue or stimulating tissue growth and that's the 250 cycle frequency that's built into the machine. To help the body to deal with what the Europeans are now calling electrosmog. And what that does is it causes its own, all this electrosmog causes changes in our physiology, just like the QRS does, but the QRS helps to rebalance that. The third field, and probably one of the most important aspects of the magnetic field that the QRS produces, or frequency that it produces, is 3 cycles per second, which is at the very low end of the Schumann frequency. That is the phase of the cycle that our body tends to see a lot of during the very deepest part of our sleep cycle, which happens about an hour into sleep and lasts for about 90 minutes. Modern science still does not really completely understand why that happens, and what happens when you are in that deep phase sleep, except that we all assume, and I think there's some reasonable information to guide us to believe that that's a major regenerative time for human beings. People who do not get enough theta sleep and delta sleep end up with all kinds of physical problems, including mental health problems, and some people have actually gone insane when they've been deprived long enough. The QRS has been found to produce benefits in a number of different conditions. It's been studied extensively in Europe, and we're now beginning to study the effects of the magnetic field in the U.S. Even weaker fields that are found in the QRS have been studied for things like MS and Parkinson's disease and seizure disorders. So even much weaker fields than what we have in the QRS have been found to have a benefit in those conditions and in other neurologic conditions. I was just reading a paper in a journal called Bioelectromagnetics where they studied both static and extremely low frequency fields, i.e. in the range that we're talking about in the QRS, with very low strength magnets, electromagnets, where they actually transplanted tumor cells into rats, and they had a control group as well as a treatment group, and they found that the magnetic field significantly inhibited tumor growth and cell death. Now, it's a slightly different field than the QRS, but we're seeing some of these kinds of studies coming out now about different kinds of magnetic fields, so it appears to be something that's fairly uniformly found with magnetic field therapies. In Europe, the magnetic field, the QRS field, has been found to significantly enhance and improve function and decrease pain, increase mobility in patients with arthritis and other musculoskeletal conditions. Because the QRS field is a fairly weak field, it's designed for health maintenance purposes. If you're going to use a magnetic field on a continuous basis or a regular or routine basis, you want to be sure that it's not going to harm you. And to avoid any potential problems with that, what the designers did is to make the field very, very weak. It varies anywhere between 1/10 of the level of the Earth's magnetic field to the peak at any given point on the mattress at about the Earth's magnetic field. More commonly on the mattress, you're getting probably generally about 1/10 of the Earth's magnetic field. That's the most common field strength that exists on the surface of the mat. Because of that, it takes a little while to get benefits. Sometimes the benefits happen very rapidly, and that's what I call the energetic level. So symptoms like pain, fatigue, sleeplessness, anxiety often resolve or respond very quickly within the first few days of treatment. It may take up to 2 weeks for significant musculoskeletal benefits to be seen, and before those benefits plateau. So about 6 weeks it tends to sort of level out, and by 12 weeks you really probably will not see any more benefit. So most of that gain can happen over 12 weeks, and sometimes what happens is even 2 weeks of treatment with the magnetic field can produce a wave of action that actually can continue for several weeks afterwards. The same is said for its use, and we recommend using the QRS twice a day, because 8 minutes on the machine can produce a wave of action like a pebble in a pond, producing waves that go on and on and on long after the pebble has been dropped in. The magnetic field causes a similar kind of resonance phenomenon in the body, which lasts